welcome to supported back bending for Lyme disease. Any other chronic illnesses that you're working with or chronic symptoms or conditions, this can also be really supportive for. Doing supported back bending postures, supportive restorative postures like this can be really useful for addressing symptoms like fatigue, anxiety, sometimes brain fog. And in particular, the variations that we're going to walk through today can be really nice for releasing some of the tension that we carry in the shoulder girdle that can ripple up into some of the pain and stiffness that some of us might be feeling in the neck and the base of the skull. So I'm going to walk you through a couple different setups for supported back bending that you can do on your own at home whenever you feel called to. I would recommend staying in these postures for somewhere between 3 to 5 minutes. If you get really comfortable in them, you can of course stay longer. But let comfort be the name of the game. It's really about allowing your body, your nervous system, an opportunity to relax and restore. So at home, get yourself a couple of blankets. Or if you don't have a couple of blankets, you can grab some towels, sheets, maybe a pillow, anything that you can kind of open up and fold into a couple different shapes. I'm going to show you how to set up the props, whatever you're using, and our friend Monica here is going to show us how to actually put the body laying down on the props. So you'll take your first blanket or towel or whatever and roll it into a long kind of snake-like roll that will go along your spine. And then you'll take your second blanket or towel or whatever. You can even use a pillow as this one because all you're going to do is make it into some kind of pillow-like shape that when you lie down will go behind your head and neck. And as much as you can, this one is actually going to come to touch the tops of your shoulders so that your whole neck gets to be supported. So, when you're ready to set up at home, your spine blanket comes along the ground like this, and then your pillow prop comes somewhere that you think your head will land. It's okay if it doesn't land exactly under the head at first. We can always readjust. So then Monica, if you would, she's going to sit at the base of that first one with her spine right up to the edge of the blanket. And then as she lays back here, her spine comes along that blanket. And this pillow one comes to touch right at the top of her shoulder. Right, so as she settles in here, notice that she moves her body a little bit to create space intuitively. Right, to give herself a little bit of extra support to settle into. However your body wants to move to become comfortable, listen to that. And then she might even take her feet a little bit wider and let her knees drop towards each other to let her hips become really relaxed. Monica, how's that feel?
Good.
Good. And then as she settles in, she might find it even more comfortable to squeeze her shoulder blades underneath her body a little bit more and start to breathe with a little more intention across the chest and collarbones. How's that feel? Good. So this is one setup. You'll notice as she breathes here that she can get movement through her whole torso. That's some of what we're looking for to help the nervous system come into a slightly more relaxed state over time to help it regulate itself with a little more ease. You'll also notice that the support underneath her neck makes it so that her chin can stay toward her throat a little bit. Right? When we start to jut the chin up into the sky, we start to get a little more constriction in the back of the neck, and we want to keep some space in the back of the neck for these variations. Monica, can we try another version? So when you're ready to come out, roll off to one side, and then press into the ground to come back up. Great. So for the second version of a back bend, right, instead of just one roll, you'll give yourself a second roll. This second roll is going to be a little bit smaller, so you won't roll it up the whole way, right? I would go about half of this blanket, right? Your smaller roll, the half roll, will go right underneath the bottoms of your shoulder blades. So, Monica, could you turn around for a second? So, Monica's shoulder blades come right across the middle of her back. So we want this smaller roll to land right underneath the shoulder blades. And then the bigger roll will land underneath her neck, kind of like the pillow did before. The space in between the rolls is a space that we've created for her shoulder blades and for her arms to come out to the sides. So Monica, whenever you're ready. Okay. So same concept as before. We want to keep some space in the back of her neck using the support of this blanket, or at home if you're using a pillow there. Right? And then this time, instead of knocking her knees in, which you can still do if that's a more comfortable version for you, Monica has let her knees fall out with her feet together, so she gets a little bit more of a stretch on the inside of the leg. Right? If that feels like a lot to you or it's an uncomfortable position, again, you can just leave the knees together instead. Another option for the legs and lower body is actually to let the knees bend a little bit and to slide another pillow, or in this case, a couple rolled up blankets, underneath the knees. That would look like this. Monica, how's that feel? Good. So again, you can stay in either of these variations somewhere between 3 and 5 minutes in order to give your body the signal that the muscles can actually start to relax. If you're comfortable staying for longer, great. If you need something to focus on, I would encourage you to follow the breath in and out for most of that time. Maybe even inviting your exhale to become a little bit longer, because that will help the nervous system shift more towards relaxation than the stress response. As you inhale, you'll find expansion, and then maybe as you exhale, you even find it comfortable to sigh out through the mouth and let go of something. How's that feel? Good. Mm-hmm. So then again, when you're ready to come out of this one, you'll roll over to one side and press the palms into the ground to come back up. Mm-hmm. If you have any questions, feel free to leave them in the comments. Otherwise, happy practicing. Hope this gives you some good relaxation, some good resetting and rejuvenation. Be well.